Hi, today I'm going to discuss with you on this chloroquine for treatment of coronavirus. Before we go into the detailed discussion on this chloroquine, let's have a look at this pandemic situation around the world. And today is March 25th, 2020, and the total case of the coronavirus is 439,941, and total deaths 19,744. And let's look at the situation by individual countries. And as of today, this virus is affecting 119 countries and territories. So looks like that every country and territories is affected by this virus. At this stage, and looks like that the Asian countries like in China and also Japan and many other countries looks like they have a good control on the situation. So, but in European countries and America, they have a significant increase of new cases and new deaths. For example, Italy, so the new cases more than 5,000, new deaths is more than 700. And in US, the new cases past 11,000. The new case close more than 200. And Spain, the new case more than 6,000. And new deaths close to 700. So in the old European countries and America looks like in the pandemic. Yes, doctors and scientists are working full speed, try to find cures for this virus infection. And a lot of news around. And we have many news before that chloroquine is maybe effective for treatment of coronavirus. And people get this news and start to self-medicate for this chloroquine. And this is an unfortunate tragedy. This Arizona Cowboys, and they take this chloroquine, and bad things that they don't take the pharmaceutical grade of this chloroquine, and they take this chloroquine for treat aquarium, and this is for fish tank quality of the chloroquine. So, and the man died of the heart attack, and the woman is in serious situation, and right now she's in the hospital. Good thing is that she's on stable situation, not right now. Not only this case, but many other reports also indicate that some people take self-medication of chloroquine. For example, 2 men in Nigeria was died after they take this chloroquine. And it is really serious situation. And please don't self-medicate of the chloroquine, because this drug is not approved by any authority in the world to treat this coronavirus disease. So if you want to take this drug, you need to have contact with your physician and ask for advice. At least you need to take this drug with pharmaceutical grade, and at least you need to know the dosage. And all this dosage in for non-pharmaceutical may be a very high dosage, because the pharmaceutical grade is much lower, should be much lower. And I come out with one paper tell us why it's not a good idea to take this drug for treatment of the coronavirus, especially that if you take as a self-medication. And this paper is written by Dan Vagano, and so it said chloroquine is being taught as medical drug for coronavirus, but there are reasons to be wary. So you need to be very, very careful. If you want to take this drug for treatment of coronavirus. So in the introduction, it said this significant surge in demand of chloroquine and hydroxychloroquine, and so the manufacturer indeed is ramp up the effort to produce more because the surge demand. And we need to let you know that this drug is approved by FDA for treatment of malaria, mumps, and rheumatoid arthritis. But please know that this fluctuating dynamic situation we are actively engaged on. That means that chloroquine has been used to treat malaria for decades. With more recent reformulation of hydroxychloroquine, and often prescribed for patients with mumps and arthritis. And it was approved to treat malaria by FDA in 1949. So it can also readily prescribed off-label by physician for this COVID-19. And it should point out that this drug is not approved by FDA for treatment of COVID-19. So right now, it's basically the passionate use of this drug for treatment of this disease. Because right now we don't have any established treatment for the COVID-19. So caution number one is that evidence of chloroquine effective is very weak. Yeah, we know that Chinese, South Korea, and have used this for treatment of COVID-19. And most recently, this French group showed that and this drug can be used for treatment of coronavirus. But all this study is not systemic design. It's not designed for the drug approval for treatment COVID-19, and not even the phase 1 stage of this drug. And the safety and efficacy is not approved. So right now there are many studies on the process. So we will soon have some data from this study to give more people more idea. And second is that this drug have side effect, and at least based on mere clinical data, such as this drug have interaction with 14 drugs, and may result in very serious side effects, include blur, vision, nausea, vomiting, cramp, headache, and diarrhea. And also, hydroxychloroquine may have caused some kind of mental change. So you need to be very careful. So again, if you want to use the drug, try to contact your doctor. So at least you can take this pharmaceutical grade of this drug, and also you need to know how to monitor the drug use. If you use this drug, and everyone going to take this drug, there may be shortage for people who really need it. As I mentioned, that this drug is approved for malaria and also mumps and arthritis. And for many people with mumps, there are no alternative to this medication. And hydroxychloroquine and chloroquine are the only method to prevent inflammation and disease activity that lead to pain, disability, organ damage, and other serious illness. So that's why don't rush to use this drug, because some people really need it. On the other hand, and this drug may not be effective for coronavirus, so you waste resource. And so the people really need it don't have it. And also the rush for drug may interfere with effort to treat it and to test the drug in the clinical trial. Yeah, there's so many clinical trials go on right now, and the best evidence is just incomplete and invalid whether it's work out or not. So there's many scientific design trials right now is going on, because in the trial we need at least two arms. One is give the drug, one is without the drug. So if you take drug and you are enrolled in this clinical trial, so they may have interfered with the clinical trial data. So at least if you take this drug, please tell doctor that you already take it. So you may not participate in such clinical trial, because in the trial that half of them will get the drug, half will not get it. So you have good control. Yeah, that's forced drug help may take the break of the social distancing too early. We know the hardest part of this flattened curve comes in weeks ahead of the US. So where current rate of increase, the nation counts for more than 6,000 right now, and that may grow to 100,000 by the end of the month. So it takes weeks for social distance to start bit into the new case number due to the 14-day infection period of the virus. And so right now we have everything shut down and the economy tanks. People are still developing disease, heading into hospital, into new case count. So if we take this forced help, this drug will be effective. People may start to don't follow this social distance order, and that's what this is still at this stage. Social distance is still the way to go. We see the results from China, we see the results from Korea, and we see the results from Japan. And right now, the most effective way is social distancing. So by only this way, we can prevent the virus spread, and that's the only way we can control this disease. And this is update for today, and I wish to see you in my next video. Bye.